example, forgetfulness, not remembering that you attended a wedding and you wanted to get tested for ADHD, what kind of testing would you be most appropriate for that patient, right? PHQ-9, GAD-7, MCHAT, or MoCA? MoCA, right? MoCA is a test of cognitive deficiency. You're looking for cognitive deficiency, right? So just make sure you know these things. But this is not any different than what we have been teaching and helping others, right? So remember the three functions, brain function for ADHD. She said all three questions were there. So I would look back on your crash course review and really look at it and understanding of the content that we are kind of going over and over and over again. So the goal for this week is that everyone should complete your question bank this week. Everyone, right? Really complete your question bank module 1. That's where we're going over today. We just finished 2 days of module 1, scientific foundations. And now is your time to practice. We're going to practice a little bit today, but we can't do that for all the questions. You have to, this week, between today and tomorrow, if you haven't done so, complete your 150 question scientific foundation, because that is going to cement what we went over in the last 2 days and today, right? So don't let it rest, and then print your PDF. You should be looking at this material again every time, but now only with the PDF, because you can do it very fast. Or better yet, use your Brainscape, because you can be on your phone while you're in the bathroom, while you're at work, while you're waiting for your food. You just keep looking at the same stuff over and over again. That is a very, very effective way of studying, right? If you don't want to carry the PDF with you, use the Brainscape app, and then kind of get that taken care of early. And you have to review. Just say, okay, I did module 1, sure. But you are not going to remember everything on module 1 3 weeks from now if you don't review this material again. It's a lot. Okay? But stay positive, because very, very, very rarely we have someone that has not been able to achieve success. 99% of the time, that's the passing rate. That is as high as can be. All right? So, Taira asked, what's the app? What do you mean by that? Are we talking about the Brainscape app, or are we talking about today's event, Kahoot? Yes, the Brainscape. It shows the achievement. So, Mrs. Patel, just get your phone and do the QR code here. When it shows up, it's going to ask for a PIN number or a nickname, or both. Okay, I selected the nickname. So if you select a nickname and you see yourself in the screen, that means you are good to go, that you are going to participate on the game. So we do the test in the modules more than once. If you want to speak to that, whoever asked that question, you can unmute yourself and ask now.
Can we do the I started the questions, but then like sometimes I don't finish. Can we retake the test?
Yeah, it's not a test, right? The question bank, yes. Mm-hmm. Now the diagnostic test, yes. Right. You can retake as many times as you want. So let's say you stop at question number 50, and then you're like, oh, there is 100 more to go. And I would keep the window open, and then whenever you get the time, finish it off. But if you close the window, just mark down where you stopped, question number 50, for example, and then go right back to it later. We are going to switch the website for the question bank very soon.
I can't do that.
What do you mean?
So like on the question bank, it doesn't let me like go back and find like the number that I was on.
No, yes. So let's say you finish question number 50. It's going to start number 1. Just click any answer until you go back to number 50.
Oh, okay. Click through.
Yeah, just click through it. I mean, at that point, you're only looking for the rationale and the answers anyway. We are changing question bank very, very soon. And when that happens, I'm going to send you guys all the new app and things that we are doing in the back end to transfer. It's just a load of work.
Do the
Load
question?
of work.
Do
But
the
for now, don't worry about it. Keep doing what you're doing in the question banks that we have, okay?
okay.
Yeah. Mrs. Wilson, you have a question?
Yes, I was still inquiring about the Brainscape. You said we can access our question bank on that app.
Not a question bank, but you can access the whole module on the app, right? That is something that's separate than what we do. This is not part of the course, but is a 3 months membership to Brainscape app. Basically,
okay.
yeah, for $49, you get to study the whole content very, very fast. Very, very fast. We can go over there after
Okay. Thank you.
after today's event, and I can show you how it works. But it really works for your advantage as far as time management, as far as really getting the stuff right. So, all right. So we're about to get started. We're gonna give 3 more minutes of grace period. Hopefully by now everybody logged in. If you are playing Kahoot the first time, remember that you are going to answer the questions on your phone, right? So you're using the phone to log in the answers. So you get points for being fast and you get points for being correct. So the reason why we do Kahoot is not only to discuss cases and questions, but also to get you going within 1 minute. So you have 1 minute per question. Remember, on the test, you're going to have 1 minute and 20 seconds. I mean, you can have as many minutes as you like, but ideally, you keep at 1 minute and 20 seconds and you should finish the whole 175 questions on time. Okay, so there is two purposes of today's event. Alrighty, so we are about to get started. Is anyone still having difficulties? Okay, sounds like everybody in. Let's go ahead and get started. Go ahead, Maisha, you have a question? Nope. All right, then it sounds like everybody that wants to play is in. Mara, you have a question? Unmute yourself. All right, I'm not entirely sure. Can you send the link for this Kahoot? I cannot hear anything. Yes, go here to www.kahoo.it. It's going to ask for the PIN code or nickname. If you ask for a nickname, you create any name you like. If you ask for a PIN code, it is 830591. Sorry, 591. For the Google link, you are at the Google link. Okay. All right, folks. So we gotta get started. Otherwise, we'll be here. I cannot hear anything.
Dr. Lopes.
I never received the email. You are in the link for the game. To play the game, go to www.kahoot.it. Select a nickname. Eight 3591. All right, folks, this is it. Otherwise, we'll be here for a little while. Good luck, everyone. Okay. So the game is about to begin. You have 1 minute per question. If you're first time playing the game, use the phone to select one of these 4 colors. All right. So someone that's experienced heightened anxiety and depression, right? They have a problem with serotonin and norepinephrine. But be mindful that major depressive disorder is serotonin, norepinephrine, and dopamine. Now, when it says the most likely, you got to pick your best choice out of the 4 answers. Okay. Remember, norepinephrine, too much of it causes anxiety. Serotonin, too little of serotonin causes depression. Right? Dopamine and GABA are the 2 neurotransmitted most likely involved with substance use disorders. Right? Histamine in itself keeps you up, right? This is why it keeps you alert. This is why we give a antihistamine, such as Benadryl, such as Atarax, to help patients go to sleep, right? So today I had a very interesting case. I had so many interesting cases in one day. So today, I think the most difficult case was a pregnant patient, 32 years old, had twins just about 2 months ago, 3rd child in 3 years. Been on depressive episode for almost 3 years. She's currently on Zoloft and Atarax breastfeeding, right? So, but it's not working. Then what to do, right? So I'm very concerned about breastfeeding because I still don't want to give, she's sleeping 2 hours a night, right? And she's in a very, very demanding job, but she's only sleeping 2 hours a night. So the question is, what kind of medications would you prescribe that will affect the baby the least? You got to keep those things in consideration, right? She does have pain. She is very depressed. So what do you think I did? I actually went with Atarax, 50 milligrams as one of the options. I put her back on Zoloft, but I'm going to increase the dose a little bit faster. And outside the box, I did a consultation for TMS, right? Sure, I have many options as far as medication, but I do not want to harm the babies whatsoever, right? If you put on something that will cause respiratory depression, twin babies, malnourished, we don't want to risk that. So thinking outside the box, okay, how can I not increase the antidepressant very fast and still conquer the goal of helping the patient with major depressive that has been resistant for 3 years. So TMS, this is how I went today. Another one, my last patient came in with blood pressure, clear ADHD, and I was going to prescribe the medication until I took the blood pressure and it was 156 over 93. I am not going to prescribe a stimulant when someone is clearly has not been managing their blood pressure well, right? So it needs to do a referral for primary care, come back when the blood pressure is under control. So lots of good cases that I did today, and this is soon will be you, okay? All right, next one. One second. So interesting too. Yeah. So let's talk about this. Okay, great. Back in. When you have someone with lithium of 1.6, what you should do? Discontinue the medication. Discontinue the medication. What if, go ahead, Myra, you do have a question? No? Okay. Uh, Moran, do you have a question there?
Oh no, it was at the beginning.
Okay. Okay. So lithium at 1.6, you discontinue the medication, right? Because of toxicity. If it's 1.5, you discontinue the medication. If it's 1.3 or 1.4, you assess for symptoms. If the patient has symptoms, discontinue the medication. No symptoms at 1.3 or 1.4, continue the medication. Remember that lithium is a high yield topic that you will see questions on lithium specifically in relation to dehydration. So what do you have? Somebody's working outside for long hours, playing soccer, going camping. You need to educate the patient or assess if the patient understands that they need to take lots of water. Okay. Remember that lithium causes problems in our heart, right? So you need to assess whether the patient's mother, if the patient is bipolar and the mother was bipolar, was taking lithium during pregnancy, right? This is application of what we teach in the course. Okay, again, it's a mood disorder, right? So this one is a little bit harder. This a little bit harder, right? Dopamine would be someone that it is or has the lack of motivation, right? So remember, serotonin, mood regulation, sleep, appetite, cognition. Low levels of serotonin leads to depression. High levels have been associated with mania, right? Norepinephrine is involved with fight or flight, responsible for regulate attention, arousal, and moods. Imbalance can cause mood fluctuation in bipolar, right? Dopamine, often related to rewards, right? If someone's not motivated at all, for example, despite of what they have to gain if they pass the board, right? That would be a lack of dopamine or too much dopamine. Now we're looking at schizophrenia and positive symptoms of schizophrenia, right? Tricky question though. All right, so I'm very proud everyone got this one correct. So there is very little to go over. Let's just jump right into the answer, right? What are the signs of that we talked about yesterday? What are the signs of a lithium side effects? Give me at least 5 that we talked about yesterday, right? From side effect, not toxicity. Okay, I just want to make sure. Anyone can tell me on the chat or can mute your mic.
Leukocytosis.
Increased
Yeah.
urination.
Increase what?
Urination.
Sure. Polydipsia, polyuria.
Fine
Okay, I'll take that. What else? Fine
Fine
tremors.
hand tremors.
Okay, confusion is more towards toxicity. If you
Toxicity.
can say lethargic, maybe, right? But if it's mild confusion, okay. But it's just confusion can be widespread. What happens to the white blood count? Hypothyroidism, yes. Rash, papillomacular rash. What happens to the white blood count?
Psychosis.
Increased white blood count.
Okay, leukocytosis, right? What happens to the EKG?
Mhm.
Come on, guys.
Inverted T wave.
T-wave inversion. So yeah, so those 5 signs that we just went over now, you need to know. Okay? All right, T-wave inversion. So great job there. So remember, what labs do we get for lithium?
Yes.
TSH because of hypothyroidism. What else?
BUN and creatinine.
BUN and creatinine to assess your kidneys. What else?
Pregnancy test.
Pregnancy test because of its effects on the baby. And what else?
EKG.
EKG. All right, so this is what we covered yesterday. So good job, everyone. Let's move on to the next question. Always try to recover what we went over, okay? It's a hard question, right?
Can one change her answer?
Can't change it. All right, this is a hard question. I thought so, because you have three possible answers, right? Remember that on the test you will have right answers, but which one is the best answer? And if it's not answering the question, then it is an incorrect answer. Okay, so now let's see the rationale here, and then we can talk about it for a second, right? Lithium may be higher due to the decreased renal clearance. Remember how we talked about alcohol can be an inducer and an inhibitor, whether it's induce if it's abuse or binge drinking, and inhibitor more so like in this case it can reduce renal clearance. Alcohol use can lead to impaired renal function, and since lithium is primarily excreted by the kidney, right? So in higher lithium levels in the bloodstream, so can really affect the medication in different ways. But here, more so, we're talking about alcohol and how it affects the kidneys, which will affect renal clearance. Not so much at all whether it is inducers or inhibitors, right? So, okay, next question. Yeah, lithium can modulate glutamate receptor and reduce impulsivity too, right? So that is a true statement. You know, another thing that I saw on my patient today, remember the patient that I mentioned being super depressed? When I did her med history, guess what I saw there? All right, progesterone. We just covered this yesterday, that progesterone is one of the medication that could cause depression. Sure, I'm not blaming on the progesterone, but it's something else that we could link to what we learned and actually makes a difference on the care that we are providing, right? It's just something to be aware of. Yes, lithium has a mechanism of actions involved in the modulation of glutamate receptors, right? And the decrease impulsivity and aggression behaviors, making it a medication valuable for patients at risk for suicidality, right? All righty, great, great, great deal. Ooh. Okay, this is a very hard question, okay? Even though most people got it right, we can talk about why. It's a very hard question, whether everyone got it right, okay? But there is something called diabetes insipidus due to lithium, right? Patients have excessive thirsty and excessive of urination. And what would be the treatment? If someone's having diabetes insipidus due to lithium?
Is it that DDAVP?
The desmopressin.
Yeah.
Yes, desmopressin is one, but what's the other?
Anticholinergic.
No, but good
That-
thoughts.
Would you just switch?
No. It was something, it was one of the
Okay.
options there.
What was the question
Oh, you
again?
could dialyze the patient too.
The diuretic.
Diuretic, right? And there is the reason why it's very hard is because it's so counterintuitive, right? Prescribing diuretic for food balance without confirming the lithium level would address potentially toxicity. If it's not appropriate, it could worsen the symptoms. Sure. But let's say that you have ruled out, if you have really done your work and the patient, it is perhaps having this side effect due to lithium of extra urination and polydipsia, the counterintuitive thing to do is to prescribe a diuretic, but that could potentially be the right medication for the patient. And we can talk about the why, but it is a very difficult thing to do, right? Because you don't think normally that would be one of the answers. And again, this is more of a real life than it is for tests, but just be mindful of that.
Thank you.
All right, everyone got this one right, I hope. As I suspect, is mainly a repeated question, right? All right, so everyone's really tracking what we learned yesterday, right? So I'm very, very proud of that. Does anyone kind of know like uh how taking a antidiuretic actually works for someone that's having the problem lithium induced diabetes insipidus? Anybody wants to take a guess?
It works off the hormone.
Mm, not so much, but what it does basically, for example, someone is have diabetes insipidus, and this is because of the lithium. So when someone taking a diuretic like, I don't know, thiazide, it slightly dehydrate the body. If normally, right? And your body goes, whoa, we need more water here. So earlier in the kidney filtration system, when we do this, it tries to reabsorb more water and salt than unusual, right? When it's going into a dehydration phase. So by the time the fluids get to the leaked part of the kidneys, or where the lithium causes the problem, there is actually less fluid arriving in that portion of the kidney. So the results that you get is like, think of it as a liquid faucet. It's still there, but there is less water coming through it. So the water ultimately leaves the body as urine, but it turns down the main water supply of the faucet. So basically, it's also kind of clamping instead of letting go due to diabetes insipidus. So it is a very paradoxical, difficult maneuver, because you think, no, I'm not going to give a antidiuretic for someone that's already having a urinary problem. So if you think, what other medications can we give in that case? We can do a potassium sparing diuretic, like what's that called? Amelioride, right? A potassium sparing diuretic. Or thiazide would be a good options as well, right? Just so you kind of be aware of that. That could be something that you would eventually see in practice, but it is difficult. And in those cases, you really want to have the patient in ICU if it ever becomes to something like this, right?
Do you teach that in your psychopharmacology class?
Yes.
Okay.
Yes. Yes, because that's a physiology and anatomy 101 in depth for sure. Where the salt is excreted, where each one of the loop diuretics, whether they work, whether they take salt, potassium, what is the exchange? Yes, for sure. All right, very good. So another patient that I had today, we can link to what we learned yesterday or the day before. Remember what valproic acid does, right? Oh, yeah. So valproic acid does in relation to other mood stabilizers. So yesterday we said valproic acid and lamictal, right? It will increase the lamictal levels. So one of my patients today had valproic acid and Latuda, right? So immediately I asked for the labs of both. just to make sure that the valproic acid wasn't inhibiting, meaning more in the body than what I actually need to control the condition, right? Even though he wasn't showing no symptoms of excessive Latuda or valproic acid, you still want to be mindful of those things. So when I saw valproic acid and Latuda, immediately I was like, okay, we just covered this yesterday with Lamictal, but we also specifically stopped during the course just to show that valproic acid, it is a potent inhibitor. We also discussed other potent inhibitors such as the clindamycin, right? So you should be knowing like those key terms or medications, they are very likely to show up on tests because they are actually very likely to show up on real patients as well, right? Okay, so yeah, this is a lithium side effects, right? Anytime you see a question where patient has been stable and then something else happened, now has become either a side effect or possibly even toxicity level, right? But in this case, there was nothing that said, hey, nephrotoxicity. This is talking about the kidneys, right? There was nothing to suggest nephrotoxicity, right? And those symptoms was gastrointestinal symptoms, right? So something we can learn from here is don't pick a fancy answer just because it sounds good, right? Make sure that it makes really sense. Okay. What else? Okay.
Professor?
Yeah, the confusion throws you off for sure.
Yeah.
But what do we have? Diarrhea, nausea, and confusion, right? Okay. Oops. Okay. Sure. We'll answer that question in a second. Okay. I can see why ordering the lab test to assess hypothyroidism, but I get it, that weight gain, you can link to hypothyroidism, but how about the thirst mechanism, right? So it is not a hypothyroidism case, but it is an expected side effect: gaining weight, thirsty, right? Some kind of tremors would be expected, part of taking lithium specifically for long term, right? This why lithium and dehydration so high yield, very, very high yield. Whether someone's going camping, playing soccer, constructor worker, outside, physical exercise and taking lithium, because it will cause thirsty and dehydration, okay? Okay. All right. So let's take a look here on the rationale. The key here was persistent hand tremors, right? Leukocytosis in this context may suggest a reactive process or a benign side effect of lithium. True. But if anything that says persistent, excessive, projectile vomiting, right? It is not a side effect. It should be more of a toxicity level, right? Okay. Remember, Kahoot can only put so many characters there, so sometimes you have to be very creative to make up an answer. All right, okay. So dehydrated reduce lithium levels via kidney excretion? No, again, it can be misleading the way it was written. I get it. It just doesn't allow me more characters to put in. Now, the green one, dehydration reduce lithium through increase lithium excretion? No, right? Because dehydration doesn't increase lithium excretion. It would decrease lithium excretion. And no one picked the blue, so okay. So it is leading to decreased renal clearance by the kidney. All right. We're almost there, halfway through. Okay, perfect. So we covered this yesterday, right? ACE inhibitors, ARBs, any medication that affects the kidney. Be very careful with the NSAIDs and lithium, right? Because the NSAIDs will likely to increase the lithium level, right? By reducing renal filtration rates. And then you have here the reasons behind it, the why. Okay. All right, so yesterday we covered how hyponatremia and hypernatremia also could increase the lithium level. It's not just hyponatremia, but hyponatremia is definitely the most high yield. Okay, so let's see here. What else? It doesn't lower the lithium level, it will increase the lithium level, right? And again, look at what A says. Hyponatremia decrease lithium levels by enhancing renal excretion. So it's saying the same thing as this, right? So we could eliminate these two choices. Essentially, the green and the red is saying the same thing, at least the end results. All right, so 5 participants hit a 15 question streak. Wow. Okay. Okay. So a little bit of trickery here. This one, very tricky actually. Okay. I'll put a question mark on this one for the validity of it, right? Because hypokalemia does affect lithium, but more so if the lithium is the real question is, why is the patient having hypokalemia, right? So that is the real question. This why is a little bit tricky here. It's not so much the hypokalemia increases lithium level, okay? So yeah, so it's a little bit tricky question here, okay? So we got to find out why is the patient having hypokalemia. In that case, the lithium level is being affected, kidney is being affected, therefore will affect lithium.
I have a question.
Yes.
The answer, so what's the answer, just to be clear?
Well, I don't even remember the answer. So it says hypokalemia can increase lithium.
No, it's supposed to be
lithium. Yeah.
Because with the sodium is the opposite, right? But with potassium is exactly so. If potassium is low, lithium is low. If sodium is high, then lithium is low.
The answer is lithium low.
The answer is decreasing lithium levels.
That will be the answer, yes.
So, but we could go like in very much detail that what I'm trying to say is that potassium doesn't really have a very strong hold on lithium. But potassium, whether it's high or low, affects the kidney. So why is the patient having a low or high potassium? That is the real question. And therefore, we'll have a decrease in lithium, possibly if the kidney is being affected, so possibly you have increased lithium levels, right? We can go back to this one a little bit because it's a little bit tricky how the question was made up and the answer in itself. Okay. All right. So everyone's really tracking this one.
Dr. Lopez, the screen disappeared. The question.
I still see the screen.
Okay, then maybe it's your phone. I don't know. I don't see it.
I don't think the answer is here. I'm not
The
sure.
answer is wrong.
All the answers
The
are wrong.
answers are wrong.
There's no answer. The correct answer, Doc. All of them are wrong.
Yeah, they are wrong too.
Which one is the best wrong answer?
No, I don't think he entered and he keyed him in.
There is no right answer there.
I did not choose anything. They are all wrong.
I think the question is trying to
Repeated
inquire.
the same question, the same
Two
answer.
options are the exact same, so I think one was mistaken.
Yeah, it's a typo probably. We lost him. Did we?
Yeah.
Do you see the answer?
Or the rationale?
He's
it came up.
off. It's like his he lost internet, I guess.
Did you see the rationale? Do you still see it or no?
I saw
Guys,
that.
I don't think this is correct. The wording is wrong.
It is no correct answer there. They're all
You
wrong.
don't see anything on this.
All right. Sorry, I lost contact.
We don't have the correct answer. No answer, Doc.
Yeah, so sorry about that. I think the answer was messed up there. So let's talk about the previous question because I want to.
You are muted.
I think his screen froze again.
It's frozen. Yeah.
Guys, I'm not sure what is going on with. I'm being kicked out of the meeting. So apologies. Do you guys hear what I was talking to myself, I guess, because do you guys hear what I said about the potassium fraction?
No.
All right.
No.
Two things. One is the most important for real life. If you have someone with low potassium, you have to start digging deeper the reasons why, right? Most likely they may start having some kind of acute renal insufficiency. Okay, now the technical problem with lithium and low potassium. Let's say someone has oh gosh, I'm not even on camera. Let's say someone has low potassium. So what the body is going to do? Hey, we need to conserve, right, the P by conserving sodium. And lithium is like a sodium. Accidentally, the kidney start picking up lithium and leading to possible lithium toxicity. Okay, but the real question, as I mentioned, is why is the patient having a lithium issue to begin with? Is because likely they are going through some kidney dysfunction. Okay, Queen, do you have a question?
No, that was before. Sorry.
All right, no worries.
Dr. Lopez, did you mean that your question is why is the person having hypokalemia in the first place?
Yes. So that is the most important question. Because if someone is having hypokalemia, there is a kidney dysfunction going on, right? No one just goes into hypokalemia and everything is normal. So that is the most important thing, right? If they say they are having hypokalemia, they maybe are taking diuretics, maybe, which in that case, they are maybe having high blood pressure and is affecting the kidney. But the other way of looking at this, when someone has hypokalemia, what does the kidney do? What our body will do? It will try to conserve water, right? And it will do this by picking up more sodium. And lithium is just like a sodium, is a different type of a sodium. So it picks up lithium instead of a real sodium and now aggravates the problem even more. Okay.
That
But
makes
for
sense.
but for clinical, what matters is someone's having hypokalemia or hyper. There is a problem with the kidney, and that's what we need to be more concerned with. What is the problem, right? Lots of lithium questions. Right? Mhm. Yeah, so you want to keep sodium the same, specifically because I said that the hyponatremia and hypernatremia cause lithium levels to go up in different ways, right? One, it holds on to the water. In this case, holds on to the lithium, right? The other one, it tries to pee it out, the water, and picks up more lithium instead, right? So yeah, you want to really maintain the same balance. You don't want to do drastic changes because lithium and sodium, changing sodium will affect the lithium levels very directly. So the one electrolyte you need to be mindful with lithium is sodium. Okay.
Professor Lopez.
Yes.
So that means the same effect sodium has. When it's hypo or low sodium, lithium is high. So same for calcium and potassium then, right? That's what you're
Yeah,
saying.
it's sort of more so with hypokalemia. But again, the real question is why someone's having hypokalemia.
Yeah, no, the question was asking about what happens to lithium when potassium is low. That was the question. So
yeah, so basically it tries to hold on, right, to the it tries to excrete sodium, picks up lithium instead, and therefore you have a higher lithium levels.
okay, thank
No, with Dr. Lopez, my strong belief is lithium will be
Hold
low.
on, we'll come back to this one and we'll talk about it in a second. Today. Okay. So can you guys read what I said in a chat box here? If I just misspoken, I don't remember if I did or not. All right, Marie, go ahead. Or Queen.
Yeah, okay. So I feel like there's some confusion for me personally because I assumed or I thought, because I feel like we went over this before prior, when sodium is still high in the system, yes, lithium is acts like a sodium. So if sodium is high and lithium is high.
Okay, so let's stop here for a second. Sorry. So if the sodium is high, what will the body do?
If sodium is high, it's going to retain lithium, but we're saying hypokalemia.
Okay, hold on. How? Right? So let's not talk about lithium. Let's talk about high sodium. If my sodium is 148, all right, 149, 150. So I have a lot of sodium in my body. What will the body do? It will pee a lot? Or will it
It will retain water.
tends to retain water, right? So water follows sodium. So yeah, so it will kind of hold on to the water, right? When it holds on to the water and excrete the hold on to the water, it will hold on to the lithium. So we got 1 point out of the way, right? Because it's not going to excrete, it's going to hold on, right? So less peeing, so less excretion of the lithium. Does that make sense why the hypernatremia and lithium works that way?
Yeah.
Makes
sense.
Right? Because what the body's going to do is like, hey, man, you're too dehydrated. You have too much sodium. Let's hold on to the water. So I'm going to stop peeing. And guess what? Now lithium's not going nowhere.
Isn't it the other way around?
Yes, but now let's see the other way around. Now let's say that the lithium, let's say sodium is low. Usually sodium is low because
lithium is high.
Well, in terms of water.
Yeah, I think you're mixing it up. It
So-
should be the other way around. When one goes up, one goes down.
Sure. So think it this way. Think it this way. If you have a low sodium, why do you have a low sodium? It's usually because you have a lot of water. Because
you have lithium too.
Yeah, but if you have a low sodium, when you collect the labs, we're going to look at how much sodium is it within the lab, right? So in order to make, let's say you have 10 particles, I'm just making this up, 10 particles of sodium, and you have a lot of water in it. Okay? So now the body is kind of saying, hey, I have very low sodium here. So what do we need to do? We need to conserve. So if you have low sodium, I need to conserve what? I need to stop peeing the sodium out, right?
No,
and I need to pee just the fluids out, kind of keeping the sodium if I have low sodium and dehydrating the body because I have a lot of volumes, right? Not clear? Not clear, right? Okay. Okay, let me write it down for you here. And we'll keep on going because this one can be a little bit of a tricky, whether it's hypo or hypernatremia. So let's go to the next question and we'll go back to this in a second. Okay. What is the next question here? All right, so next question. Everyone got this one good. Okay. Okay. All right. So were you guys able to take a look what I mentioned about lithium here, as far as how lithium, low and high, does it make a little bit better sense now? So low lithium, right? I mean, low sodium, not lithium, gosh. Kidney says, hey, save sodium, right? If it's low, save sodium. So the kidney saves more lithium instead, which lithium will go up. Now, the other way around, let's say high sodium, hypernatremia, what the kidney is going to say, hey, get this sodium out, right? So now the kidney gets rid of the lithium. In this case, the lithium goes down, which causes if it's high. So when we are exchanging, trying to take the salt out, it causes a confusion between lithium and sodium. So it's excreting the sodium, but keeping the lithium instead. Okay. So it is a bit confused topic, but for the test specifically, think of hyponatremia as the number one electrolyte that you need to be concerned with. Okay. All right. So hopefully that helps a little. I know it can be a bit confusing with this hyper, and what it does to the water, and how is lithium involved as well. It can be super confusing. So this is important, right? Neuroprotective effect can potentially improve cognition while reducing cognitive decline in individuals with bipolar disorder. So number one neuroprotective medication of choice. Okay. All right, so the problem here says persistent, right? When this is persistent, then you should be thinking of toxicity level, right? All right. Okay. So between A and B, right? So when we say hypertensive crisis, what is the antidepressant that comes to mind?
MAOI.
So that is a clear indication, MAOIs, and a mood stabilizer. It didn't say which mood stabilizer, but which mood stabilizer comes to mind that would be an inhibitor?
Depakote.
Depakote. Let's say now you kind of figure that out because of the super high blood pressure, right? So you want to discontinue both. You don't want to keep the inhibitor there for a long time either, because even though you stop the medication, if you keep inhibiting what's left of the MAOI, it's still going to keep driving the high blood pressure. Okay. Someone with that high of a high blood pressure, they need to go to the ICU. Okay. Okay. See here. Sorry about the misspelling there.
I thought about the misspelling too.
Yeah. Now I have some people that do the game for me because these games takes about a good 5 hours of work, and it never fails me. They always make a mistake. All right, so you want to discontinue lithium and order lamotrigine, right? Okay. Good deal.
Isn't this the same question?
It is. So let's get the same question right.
The bonus.
Yes. Let's see if anyone's gonna pick the wrong answer. Okay. You know what? Shinoma that called me today, and she says, I can't believe the same question was there on my previous test. Hey, so make sure that that whatever, if you have taken the test, you kind of learn from it, because you might get the same question or something very, very similar. All right, so everybody got it right. That's good. Good sign. Okay. You know, it never fails. Somebody picks the wrong one trying to be too fast.
Question.
One quick second, please. Let's finish this one because I can't stop. Okay, you want to continue the current dose of med as it's considered safer, not safe, during pregnancy. Safer, right? There is always the risk. Someone had the question earlier?
Never mind, Doc.
Okay. Moving on. Last question of the day. Everyone should get this one right. Even by test taking strategy, everyone should get this one right. Should have 100 answers, all correct. All right. Why should everyone get this right? Well, it's talking about DAPA code. Does DAPA code cause EPS?
No.
No.
Does DAPA code cause NMS?
No.
Are we talking about lithium?
No.
So even if I don't know what the question's talking about, it can only be the green answer. So guys, this is why I say this all the time. If it's serotonin syndrome, only by serotonergic agent. Yesterday I repeated this 10 times. If it's neuroleptic malignant syndrome, for the test, we are only think of antipsychotics.
Antipsychotics.
And, you know, we cannot mix cryptoheptadine with bromocriptine or dantrolene. Two different conditions and can be applicable in different ways. So this one was, even if you didn't know that ammonia, which you talked about yesterday as being one of the side effects, not side effects, one of the labs that we need to get for DAPA code, even if I didn't know this, it can only be this answer, right? Because the other three just doesn't make sense at all, right? So if you pick the other three, okay, this is a very important question. You have to ask yourself, is it knowledge that are you confusing the conditions, or was because you're too fast, or maybe there is some lack of testing taking strategies, right? And remember, every time that we get something wrong, there is a learning curve that's much better than getting a question right. Questions that we get right, we forget all the time, but the ones that stick with us is the one that we get it incorrect. So it is a learning process. And it doesn't mean because maybe today you're not in the top 10, it doesn't mean that tomorrow you will not, right? But we're learning as we go. So let that sink. Neuroleptic malignant syndrome, always antipsychotics. We know it's not always, right? It can be due to anesthesia, but for the test, think of antipsychotics. EPS, think of antipsychotics. Serotonin syndrome, think of a serotonergic agent. So that way you can start separating who does what. Okay? Nevertheless, this is a very competitive game, right? And we had our 5 winners today. So everyone has to be first place. Somebody needs to be first place and somebody needs to be last. But the podium always change. I have no idea why it's not showing the podium this time. What happened? Okay, rewards. Like, I don't know what that is. Let's just escape it. Let's see what's next here. Oh, something went wrong. Oh, come on. Okay. All right. That's it. Something went wrong. There is no way I can actually go back. Sherry, please ask your question. Sherry.
I had purchased the cards. Are they by Michael? Because I wasn't sure if you sent me the right deck.
Michael is there. Michael was also one of our students. So, but there is only one deck, right? So there is module 1, 2, 3, 4, and 5. So let me show my, let me see. So let me show my account and then you can see from there if I can log in. See if it allows me to log in. Okay.
Do we have to purchase the cards?
No, you do not. You do not have to purchase, right? I mean, it's not part of the course as if you would like to, but you don't have to purchase anything.
Okay.
So I cannot sign in because my computer just broke and now I'm using my wife's computer and it's not allowing me to sign in. So I cannot even share my Brainscape. I got to find my computer and be able to share. So it should have all the decks for module 1, 2, 3, 4, and 5 when you sign in, and then you're going to see Michael's deck as well in there.
Okay, because when I got the Q code, it just loaded up Michael's deck. It didn't give me your cards.
Right. So if you look to the left of it, you should see all the modules, and one of them is Michael's as well. So just kind of like take a look at it, and if you can't find it, we can meet up, and then I can go through it with you. Okay.
Okay, thank you.
All right, Stella, do you have a question? Not?